Hello, this is Ellie Hammond. I'm a clinical exercise physiologist with Ohio Health Cardiac Rehab. In this presentation, we're going to be talking about blood flow through the heart and the heart valves, which will be part one in our anatomy and physiology series. The heart is a four-chambered pump that functions to circulate blood and oxygen through the rest of the body. The four chambers consist of two atria and two ventricles. The atria act like a holding chamber that will collect blood from other areas of the body, and the ventricles are doing the actual pumping or the ejecting of blood out of the heart. So when the heart contracts, the atria will contract together and the ventricles will contract together. Now, the job of the right side of the heart and the job of the left side of the heart are very different, even though they're functioning together. So the job of the right side of the heart is to pick up oxygen from the lungs. The job of the left side of the heart is to circulate oxygen-rich blood to the rest of the body. So remember, when we're talking about the left and the right side of the body, we're talking about anatomical position, which means if this was your heart inside of your body, it would be on your left side or your right side. So when you're looking at it in a two-dimensional standpoint, it's going to be flip-flopped. So let's break down the blood flow through the heart to get a better understanding of what's happening with each heartbeat. The working muscles and organs are using the oxygen from the bloodstream to sustain their functions. So whether you're doing exercise or just performing your daily living activities, we're using oxygen out of the bloodstream. When that oxygen is depleted from the bloodstream, it's now necessary to replenish this oxygen supply. The blood is sent back to the heart via veins to pick up more oxygen from the lungs. Remember that veins carry blood to the heart, while arteries carry blood away from the heart. Generally speaking, veins carry deoxygenated blood, and arteries are carrying fresh oxygen-rich blood. Now, there are two exceptions, which we'll get to in just a second. So when the blood makes it to the heart, again, we're sending this back to the heart via the working muscles and organs. Blood is going to collect first into the right atrium via the superior vena cava and the inferior vena cava. When the atria contracts, the blood is pushed into the right ventricle. The ventricle will then contract and send that blood via the pulmonary artery to the lungs to pick up more oxygen. Notice that this is an artery, but at this point, the blood is still oxygen depleted. So this is one of those exceptions where an artery is carrying oxygen depleted blood. After picking up oxygen, the blood is going to return to the heart via the pulmonary vein, which is the other exception, because at this point, this is oxygen-rich blood. Blood will then collect into the left atrium, which will then contract to send the now oxygenated blood to the left ventricle. Now this fresh oxygen-rich blood is ready to be distributed to the rest of the body. Your heart has four valves, and they function similar to a door. So they open to let blood flow through them, but then they close to keep that blood from backflowing into other areas of the heart. You have your aortic valve, which separates the left ventricle and the aorta, the mitral valve, which separates the left atrium from the left ventricle, the tricuspid valve between the right atrium and the right ventricle, and the pulmonary valve, which separates the right ventricle and the pulmonary artery. Over time, problems can occur with these valves that might require a repair or replacement. So valve problems may be congenital, meaning they happen from birth or a birth defect, or it can just be due to normal wear and tear over your lifetime. Our heart does a lot of work for us throughout our lifespan. So the aortic and mitral valves are the two most commonly repaired or replaced due to the extra force that they receive on the left side of the heart. There are two different problems that might occur with the valves. Stenosis, which is the picture on the left there, is a valve that doesn't open all the way, not allowing enough blood to flow through. The opposite problem is regurgitation, where the valve is weak and does not close all the way, which will allow that blood to backflow into other areas of the heart. So a valve can be repaired or replaced either through open heart procedures or less invasive approaches, such as a transcatheter aortic valve replacement. You'll commonly hear it referred to as a TAVR. So TAVR is an option for patients who are too high risk for any open heart procedures. During this procedure, a small incision is made, usually either in your leg or your chest, and a replacement valve is inserted via a catheter, similar just to like you would have a normal heart cath. That concludes part 1 of our anatomy and physiology series. Thank you.